Hi, my name is Liz, and the topic of my project was the thyroid gland. The thyroid gland is the largest endocrine gland in the body. It consists primarily of the right and the left lobe, and it is connected by the thin isthmus. It is located anterior to the neck. It is responsible in maintaining our body's metabolism. The thyroid gland secretes three hormones, which are triiodothyronine, also called T3, thyroxine, which is also called T4, and calcitonin or thyrocalcitonin. And these hormones depend on the availability of iodine in order to function properly. The patient preparation, there is no patient prep needed, but it is recommended for the patient to be fasting at least 1 hour before the exam in order to avoid reflux. Before the exam, we want to make sure we review our order and we question our patient about any medical, surgical, or radiation history, any symptoms, and how long they've been having these symptoms, and any palpable masses they've been feeling. For the exam, we will need a high frequency linear transducer. We want to make sure we have everything ready on machine. We want to position the patient supine. We want to elevate the shoulders with a pillow or a towel in order to hyperextend the neck. Whenever we're scanning, we ask the patient to turn their head the opposite direction in order to have more room for the area being scanned. We want to get images in both longitudinal and transverse with their respective measurements. We also want to apply color Doppler, and if there's any pathology found, we want to make sure we do also both longitudinal and transverse views with measurements and color Doppler. The sonographic appearance of the normal thyroid, it will be homogeneous. It will also be hyperechoic in appearance relative to adjacent muscles, and it is similar in appearance to the normal parenchyma in the liver and the testes. The Hashimoto's disease, it is the most common cause of primary hypothyroid. It is also known as chronic lymphocytic thyroiditis or Hashimoto thyroiditis. It presents with goiters and intense lymphocytic infiltration. It is diagnosed through serum. Hashimoto's disease signs and symptoms include weakness, fatigue, cold intolerance, weight gain, decreased sweating, dry skin, hoarseness, constipation, and menstrual irregularities. Factors of Hashimoto disease include genetically predisposed individuals. It is associated with high iodine intake, selenium deficiency, smoking, chronic hepatitis C, most prevalent between the ages of 45 and 65, occurs mostly in females, presents with other immune disorders, and you have a higher risk of developing B-cell lymphoma. And Hashimoto disease may also be present in children. The sonographic appearance of Hashimoto's disease, it will appear coarse and will be heterogeneous texture with multiple ill-defined hypoechoic areas separated by thickened fibrous strands. It will be moderately enlarged without calcifications or necrosis. It can cause nodules, and it will also have hypervascularity. Graves' disease, it is an autoimmune hyperthyroidism caused by antibodies that continuously activate thyroid stimulating hormone receptors. It is characterized as a multi-system syndrome consisting of one or more of the following: hyperthyroidism, goiter, protrusion of the eyes, and swelling of the lower limbs. Signs and symptoms include goiter, weight loss, diarrhea, nausea, vomiting, hair loss, tachypnea, excessive sweating, warm skin or heat intolerance, nervousness, restlessness, increased appetite, emotional instability, hypercalcemia, and decreased parathyroid hormone. Factors are heredity, our body's immune system, age, and gender. The peak incidence for Graves' disease is between the ages of 40 and 60, and it can also be caused by stress. The sonographic appearance of Graves' disease, it can present itself with a normal or enlarged thyroid gland. The normal gland will appear homogeneous. The enlarged gland will appear more heterogeneous. It will also have hypervascularity or thyroid inferno, which we see in these images. And the peak velocities in spectral Doppler will be greater than 70 centimeters per second. Papillary carcinoma, it is the most common malignant tumor of the thyroid gland, and it is also considered the least aggressive of the thyroid tumors. It occurs most frequently in between the ages of 20 and 50. The overall survival rate is 98%. Prognosis is poorer in cases where primary neoplasm is larger, more aggressive, or has extended to adjacent tissue. It can also be deadly, and it is primarily caused by mets to the lungs or brain, or by an obstruction of the trachea or esophagus. Fine needle aspiration biopsy has the best diagnostic accuracy. Treatments include partial lobectomy, radical neck dissection, or both, followed by suppressive therapy. The signs and symptoms of papillary carcinoma are hoarseness, palpable mass, dysphagia, cough, and dyspnea. There are several types of papillary carcinoma, which may be pure papillary carcinoma, follicular carcinoma, encapsulated variant, and tall cell variant. The sonographic appearance of papillary carcinoma, it will be hypoechogenic in 90% of the cases. There will be microcalcifications that will appear as tiny punctuate hyperechoic foci. There will be hypervascularity, and there will also be metastases to the lymph nodes, which will also have tiny calcifications in the lymph nodes. And this is my project, and I hope you learn something from this.